So most of the people that I see in the clinic are pretty active. They are pretty healthy. I mean, melanoma just comes suddenly. So these are the people who go a lot to the beach. They had blistering sunburns before the age of 18. And as you know, even if you have one blistering sunburn before the age of 18, that doubles the risk of having melanoma later in life. They go to tanning beds. They have a fair skin, though melanoma does not discriminate. We can see melanoma even in the darker skin, but it's most commonly seen in people with a fair skin. People can develop not only melanoma, but other types of skin cancers, basal cell carcinoma and squamous cell carcinoma later in life. So the presentation usually happens this way. Somebody noticed an abnormal skin lesions been going on for a few months. Then it started changing in color. It's bumpy. It can be itchy, irregular borders, and bleeding. So it becomes irritated and draw the attention of the person. So they go and seek attention and seek medical advice from the dermatologist. An abnormal skin lesion could be on the back, and it's noted by the spouse. So the person comes to the clinic, to the dermatologist to have it checked out. Sometimes the barber notes an abnormal, irritated skin spot on the scalp. And sometimes just a trip to the dermatologist, and the dermatologist, while doing the annual screening exam, may note an abnormal skin lesion and then recommend a biopsy of that lesion. Take care of your kids. Avoid the blistering sunburns, apply the sunscreen for them. And those who are in the teenager years, try to advise them to avoid using tanning beds. Honestly, tanning bed is not different than cigarette smoking. It's like really a carcinogen. So avoid that. Otherwise, you're going to pay the price when you get older. Not only I'm talking about melanoma, but other skin cancers. I mean, there are some people who go to the dermatology every 3 months and have basal cell removed and squamous cell removed.